Should you worry about these childhood TB signs? Imagine your child has been coughing for more than 3 weeks, and you notice they are losing weight or feeling unusually tired. These signs might seem like common childhood issues, but they could also be clues to something more serious like tuberculosis. Tuberculosis is a bacterial infection caused by Mycobacterium tuberculosis that can affect anyone, including children. While it is less common in children than adults in many countries, it remains a significant health concern in areas where TB is widespread. Recognizing the signs early can make a big difference in treatment and preventing spread. In children, tuberculosis can be either latent or active. Most kids with TB have the latent form, meaning they carry the bacteria but show no symptoms and cannot pass the infection to others. However, in young children especially, the bacteria can become active if their immune system is still developing. When TB becomes active, it often affects the lungs but can also spread to other parts of the body like the brain, bones, or lymph nodes. Symptoms of active TB include a persistent cough lasting more than 3 weeks, fever, night sweats, weight loss, and decreased appetite. Some children may also have swollen glands, chest pain, chills, or even blood in their phlegm. In infants, TB can cause more subtle signs like poor growth, irritability, or swelling around the brain, which can lead to seizures or vomiting. You should be concerned if your child has a cough that lasts longer than 3 weeks, especially if it is accompanied by unexplained weight loss, persistent fever, or night sweats. These symptoms, particularly when they occur together, should prompt a visit to your healthcare provider. Children who have been exposed to someone with active TB, come from regions where TB is common, or have weakened immune systems are at higher risk and should be evaluated if any symptoms appear. Early diagnosis is crucial because TB can be treated effectively with antibiotics, but it requires completing the full course of medication as prescribed. Diagnosing TB in children involves a combination of medical history, physical examination, skin tests like the tuberculin skin test, blood tests such as interferon gamma releases assays, chest x-rays, and sometimes sputum tests. However, because children often carry fewer bacteria, diagnosing TB can be more challenging than in adults. If TB is suspected, seeking prompt medical attention is essential. Early treatment not only helps your child recover but also prevents the disease from spreading to others. If you notice signs that could indicate TB, do not ignore them or dismiss them as minor illnesses. Contact your healthcare provider for a thorough evaluation. Remember, TB is treatable with antibiotics, but the treatment must be completed fully to ensure the infection is cleared. Never try to treat TB at home with unapproved remedies or supplements. Following professional medical advice is always the safest choice. Prevention strategies are also important. Keeping your living spaces well ventilated, avoiding close contact with people who have active TB, and ensuring your child receives the recommended vaccination, such as the BCG vaccine in countries where it is used, can help reduce the risk of infection. While TB is less common in some regions, vigilance is key, especially if your child shows any of these signs. In summary, while childhood TB is less frequent in many areas, it is a serious disease that requires attention if symptoms develop. Persistent cough, fever, weight loss, night sweats, and fatigue are the main signs to watch for. If you have any concerns, consult a healthcare professional promptly. Early diagnosis and treatment can protect your child's health and prevent the spread of TB in your community. Always seek personalized medical advice for your child's specific situation, and follow the guidance of health authorities to keep your family safe.